fibromyalgia. So when I first got asked to come online and talk about fibromyalgia, I was a bit like, really, fibromyalgia? Give me something a bit more meaty to work with, like cancer. But actually, fibromyalgia is a really meaty condition when you dig deep into the research and you start thinking about those underlying drivers. Now, actually, let's take cancer, a subject that I work in very frequently. Cancer, whilst it comes with a fear factor, oh my goodness, my loved one has been diagnosed with cancer, I've been diagnosed with cancer, but yet there's a treatment. And okay, not everybody lives that treatment, but there is a schedule. And you meet somebody in the street and say, or I've been diagnosed with cancer, or it's apparent because you've lost your hair, and people go, oh, I get it. And look, I'm not wishing cancer on anybody or another kind of equally as scary a diagnosis. But what I'm saying is people get it, and people get that there's treatment available for it. But yet we've got this group of conditions that fall under these umbrella term diagnoses that truthfully, there's next to nothing available. And the impact on quality of life can be even more profound than cancer, because in many curative cancers, that individual might be on treatment. Let's take breast cancer, you know, start to finish, treatment might last about 9 months, and then they're free. Most people with a chronic condition like fibromyalgia aren't free of it. It's a lifelong condition. Well, they believe it's a lifelong condition with very little treatment options. So actually, when I really think about the meatiness behind this can be more life affecting than some of those really horrible diagnoses that we're faced with today. So what I want to do today is really dig down deep into what through the eyes of a functional medicine practitioner, what does fibromyalgia mean? What sort of things, what sort of patterns do we, the practitioner, need to consider to take our clients on a journey and to really change the destination of that journey? And then thinking about the mind and body. So as nutritional therapists, as functional medicine practitioners, or anybody else that's listening, osteopaths, chiropractors, we very much do get trained to think about the symptoms, but we also need to look at the emotional impact of those symptoms, like how debilitating pain is, for example. So the emotions that drove it and the symptoms impact on the emotion. So those vicious catch-22 circles. And then thinking from a clinical point of view. So the classification of fibromyalgia is the activation of pain points. Now, generally to get a fibromyalgia diagnosis, other conditions need to be ruled out, like rheumatoid arthritis. Now, fibromyalgia is a bit like IBS, and there's lots of overlaps between the two. In that, IBS used to be diagnosed by a gastroenterologist following on the ruling out of IBD, celiac disease, obviously anything more sinister. So when they ruled all that out, they ruled in IBS. Fibromyalgia is the same. It used to only be diagnosed by a rheumatologist who had ruled out other inflammatory diseases. So fibromyalgia should not show a raised CRP. Fibromyalgia shouldn't show an imbalance in white blood cells, shouldn't show other inflammatory markers present on the bloods. A clinical evaluation of the body should rule out, inflammatory processes, swelling of the joints, redness, heat, morning stiffness. So all of that should be ruled out before we consider a fibromyalgia diagnosis. And what we're looking for, obviously it's not us that's making the diagnosis, what the doctors are looking for is pain in between the joints. Chronic pain that is worse for touch, so palpating the areas, skin, connective tissue underneath the skin generally causes pain. So those points that you can see at the front and the back of the body are at points within the body that get palpated, but many fibromyalgia patients say they've got chronic pain everywhere. It isn't just the presence of these pain points. Now, years ago, and I can't remember the name of the guy that I went to a lecture, he's wrote a book, and it will come up. It was there, but his book is somewhere on my very extensive bookshelf, but I can't remember his name. But I went to a lecture over in America, and what he said to the audience, which I was in, is imagine in the morning you wake up and you're naked, and you get a response from the receptors in your skin to your brain to say, Joe, don't forget you're naked. Don't go to work naked. So one gets dressed, one feels the presence of clothes, and one turns off that message. So my messenger says, Joe, you're no longer naked. In fibromyalgia, those messages never shut down. So what I would experience in fibromyalgia is constant messages saying, Joe, there's clothes on your skin, there's clothes on your skin, there's clothes on your skin, there's clothes on your skin. I sat there when he did this lecture and then went on to obviously talk about more of what we're going to talk about today. And I was like, God, could you imagine? Can you imagine what that must feel like for the patient? But yet no conventional pain meds work. Yes, sometimes people respond well to other body work, but often body work like massage, osteopathy, it's too painful for these patients to even be in contact with. So what we've got to think about is what sort of things can be driving factors behind fibromyalgia. So I've got my functional medicine brain on now, because remember, I don't make diagnoses. I'm not a medical doctor. So we know from a functional medicine point of view, things that can cause alterations in our skin, brain, pain receptor brain feedback loop includes toxins, chemicals, including there is things like molds, cytokine storm from infection. So we heard all about the cytokine storm with COVID. So what happens in a post-viral paradigm is these inflammatory cytokines, which we know were really detrimental in COVID, but they are in other viruses like Epstein-Barr virus or cytomegalovirus. So we've got to think about what does the viral load look like in the individual. Hyperinsulinemia, so thinking about insulin resistance. Systemic inflammation. So yes, in theory, inflammation at a joint level should be ruled out, like rheumatoid arthritis, but is there anything else going on that's driving systemic inflammation? Please think mouth, because the mouth seems to be a constant area where there's inflammation that often people ignore, whether that's redness or bleeding of the gums to chronic infections. But so many of us ignore what's going on in our mouth, and it really is a hidden area. Drug-induced mitochondrial injury. So many pharmaceutical drugs can cause electron transport imbalances and leakage within the mitochondria. Hormonal imbalance, think particularly about estrogen dominance as a pro-inflammatory mediator. And then reactive oxygen species and oxidation. This is something you'll see in my case study, but just because that's what I'm talking about, using markers 8-OHDG and lipid peroxides is so important for ascertaining oxidation. And they're available in our tests. And then things that support fuel to the mitochondria. Think about your B vitamins, your magnesium, your malic acid, your D-ribose, your L-carnitine, your CoQ10. These are all ingredients essential for mitochondrial function. Think about oxygenation, dysfunctional breathing. How many people are mouth breathers, day and or night? We have to train people in good oxygenation. Remember, when we're stressed, we're not oxygenating our body optimally. Antioxidant protection through that lovely rainbow of color that our diet should provide. Mitochondrial metabolism. So again, this comes down to, raw materials in, not just the B vitamins, the magnesium, but the proteins, the carbs, the fats that's required as like petrol in. Physical activity, not over exercise, but physical activity, which remember also produces lots of positive endorphins. Cognitive activity, our brain health needs stretching. So, okay, at a very basic level, things like doing a Sudoku or a crossword, well, it's not at a basic level, but that kind, to playing a musical instrument and learning a new language. Our brain needs exercise, just like our muscles do. And so many of us don't do it. And so many fibromyalgia patients struggle because their mitochondria are part of the picture, or poor mitochondrial health is part of the picture. Optimal hormonal balance, estrogen, progesterone, testosterone, cortisol, cortisone, adrenaline, dopamine. This is what I'm thinking about. We've got to think about all of those hormones, endocrine, neurotransmitters being in harmony. Sleep. 8 hours is not something we sit on a pedestal. 8 hours is what our body needs to repair. Circadian rhythm, thinking about melatonin synthesis, thinking about not being on screens late at night, and thinking about eyeballs seeing sunlight first thing in the morning. Fasting, time restricted eating. Remember, our body doesn't go through autophagy until we've been fasted for a minimum of 13 hours. Most people tend to eat their last meal, I don't know, 8 o'clock at night, and they're back at breakfast at 7 o'clock in the morning. There's no time for autophagy present in any of that. So these are basics that we need to make sure from consult number 1, we're investigating and we're getting right. Now, many individuals who have a fibromyalgia diagnosis or have symptoms of fibromyalgia without the diagnosis have other coexisting conditions. And there's certain coexisting conditions that go very much commonly with that fibromyalgia diagnosis. IBS, I've already mentioned it, another one of those umbrella terms diagnosis. TMJ dysfunction. Now, when I speak to an osteopath that I refer to, she'll very often talk about TMJ and positioning of the jaw and the bite. So whether somebody's got an overbite going on, and how important that is, first of all, for our tongue to be in our mouth, to be able to close our mouth and breathe through our nose. Any element of TMJ dysfunction can straight away cause dysfunctional breathing patterns. So do think about sending your clients off to go see an osteopath, particularly one that focuses more functionally, in order to make sure you've got that assessed. Orthodontist, a good dentist can assess bite, tension, migraines and headaches, which again could come from some sort of TMJ dysfunction, or teeth grinding because of high levels of stress. Interstitial cystitis. So many women have embedded bacteria within their bladder, maybe from an acute cystitis, so a bacterial infection that then causes an embedded infection that's then caused irritation, that a urine test isn't showing infection, but they've got symptoms associated with it. Vulvodynia, inflammatory. PTSD or other anxiety conditions. Remember, you don't have to have all of these, they're just common. Sleep disorders, and then inflammatory rheumatological disorders. And what can happen is somebody can start with for example, rheumatoid arthritis, and maybe they've been medicated, and maybe the rheumatoid arthritis has been put into remission, but the way that their pain receptors have been altered, they then go into a pattern of chronic inflammation, even though on a scan, maybe I've had my wrist ultrasounded, there's no inflammation there, and it's linked to the pain receptor message to my brain being upregulated. So therefore, I experience a big amount of pain to a small amount of insult. So as a functional medicine practitioner, I always put things into antecedents, triggers, and mediators. So we know that sometimes we see familial patterns of fibromyalgia. My mum had it and I've got it. So therefore, looking into certain genomics and epigenetics, particularly around stress and stress mediated, but I also want to look into connective tissue, just because we also need to, on that, differentials rule out anything going on like with Ehlers-Danlos syndrome and connective tissue disorders, which again, a rheumatologist should be thinking through this. But what I was thinking but didn't actually voice it, just like the IBS and should only be diagnosed from a gastroenterologist, many GPs are now diagnosing fibromyalgia without referrals to rheumatologists, because in their defence, a GP might make a referral to a rheumatologist and the referral gets thrown out, because remember, wait lists are hideous at the moment. So if there's no real reason that the rheumatologist needs to be involved, i.e. raise CRP, often they're rejecting the referrals. Adverse childhood events is a big known factor in chronic conditions, whether that's chronic conditions of the bowel or the mitochondria or a combination of both. And then a family history of neuromusculoskeletal conditions, chronic inflammatory and autoimmune conditions. So just in your workup of your clients, just please do make sure you're thinking about all of those. Go right back into your timeline, dig down deep and find out exactly what was going on before you came on the seeds. Then think about triggers, things that could have been the catalyst to begin. A physical trauma, maybe they had a car accident, maybe something happened as an emotional trauma, comorbidities, infections, COVID, post-COVID, glandular fever, EBV, these are all things that could be triggers. And then impaired mitochondrial function. Maybe they were on a drug that altered their mitochondrial function. And then mediators, things that perpetuate this. Impaired mitochondrial function, so maybe that's heavy metal toxicity that impairs that electrotransport chain. Psychosocial factors, and remember, this can become a perpetuating cycle, because if I'm in constant pain, I cancel all my social events, therefore I don't have my social connections, therefore I haven't got the emotional support, which then picks up the picture of, you know, nobody loves me, and actually I lose all of my support. Chronic inflammation. So if there's inflammation, like I said, going on in the mouth, or something else, like I've got a chronically inflamed knee because of an injury, they're all things that need to be addressed with the right practitioners, the right functional dentist, the right osteopath to sort out my knee. Maybe I need it taping to take the pressure off. Changes in the brain processing, maladaptation, neuroplasticity. Now look, in 45 minutes, I don't have time to dig right down deep into neuroplasticity, but we know lots of things impact the brain and neuroplasticity, from a woman's declining estrogen levels. Sadly, us women have an increased risk of Alzheimer's on a 4-to-1 ratio. Obviously, there's lots of things we want to do to support that, to alcohol, to illegal drugs, to pharmaceutical drugs, to stress, to sleep deprivation, to brain injury. These are all things that I am thinking of in that section. And then perception, fear, avoidance, perception of pain. Remember, pain is not the physical. Pain is the response to the stimuli, and how we all respond to that is different. Part to do with the feedback to our brain, and part to do with the overstretching of the pain receptors. So factors that can affect our mitochondrial health: low oxygen, like I said, poor glucose control. So please be thinking about metabolic flexibility, which the biggest thing you can do for metabolic flexibility is time restricted eating. Start with 13 hours, build to 14 hours, 15 hours, and optimally for 16 hours. Even if you can't manage it every day, can they manage it, you know, certain days of the week? I can do it on these days based around my work. It all depends on people's commitments. I do time restricted eating Monday through to Friday because that works for me. It doesn't bother me when I'm at work. I can do 16, 18 hours, but the weekends, I break my fast earlier because it's a family connection. So just thinking about what can do. And then maybe focusing on more of a Paleolithic or paleo keto diet, depending on how insulin resistant they are. Maybe considering just a 2-week Freestyle Libre or continual blood glucose monitor to look at what their glucose is doing, not just in response to food, so within an hour of eating, but also on rising. What's their morning glucose before their feet have hit the ground? Because that one's a really good one to monitor for metabolic flexibility. Are they getting their level low enough? Obviously not hypoglycemia, but low enough that gives you an indication that they are more metabolically flexible. HbA1c doesn't do this for you. So that's where continual blood glucose, obviously fasting glucose and fasting insulin are also really helpful, but that will only give you a picture of today. And if you have, for example, been fasting for 16 hours, and it takes you to get to the blood testing laboratory, because you don't live in central London, cortisol could have altered that fasting glucose and fasting insulin. So ideally, to get a really beneficial fasting result, you kind of need the phlebotomist there within half an hour of waking, and the practicalities of that is pretty much non-existent. And then low inadequate nutrients that fuel the mitochondria, like I said, B vitamins, carnitine, CoQ10, alpha lipoic acid, increased reactive oxygen species, because that then means that our need for antioxidants is even greater to quench that free radical damage that's being created. Here's some research for you here, thinking about the gut microbiome. Now, we know that the gut microbiome is responsible for immune regulation, inflammation regulation, serotonin regulation. So particularly if there's any bad bacteria, think a promotion of pro-inflammation, but think also about lack of commensal diversity as being a potential sabotaging factor in regulating inflammation. So the gut microbiome needs diversity. The only way we can get that commensal bacteria as diverse as we need it is responsible for, this isn't about the absence of a supplement. This is about promotion of diversity within the diet. Remember, we're looking to get about 30 different types of vegetables, salads, fruit, herbs in every week. Obviously, I would say less fruit, sticking to berries, more diversity in vegetable salads and herbs. But that is easily achievable, particularly when we're doing things like smoothies or juices or stews or soups, ways to get abundant amounts of those going in. So a challenge for your clients, can we just get one more? And that's what I say to people. If you're at 5 at the moment, I'm not going to expect 30 by next week, but maybe by next week we could get to 8. Maybe we could look at other ways, like I was looking at the PACD, PACKD, most of you will be familiar with them. They're the organic frozen berries, and now they've brought out their own smoothie range, whereby you get a little packet of fruit and you get a packet of superfoods, depending on what you're trying to achieve, energy, I don't know what they are, detox maybe. So you blend together your fruit with your superfood powder. Now, that might not be for you, because you're like, well, I've already got all those superfoods sitting in the cupboard. But you know what they're awesome for? Is the clients that aren't at your level. And they're super easy, because you rip open the plastic bag, you rip open the little packet of superfood and you blend it with milk. How simple is that? But yet by adding in, obviously, a few different types of fruit or vegetables, I think some of them have got vegetables in there, avocado and greens, adding in your little packet of superfoods. They're all done so that they taste good, which sometimes I make smoothies that don't taste good because I put way too many superfoods or cacao or whatever I'm trying to add in there. But you know what? They're simple. And remember, for these patients, they've probably got very low energy, very high pain, probably not sleeping or have a higher sleep need. So let's try and make things as easy as possible for them. Now, from a sleep point of view, like I said, many of these individuals have a high sleep requirement. So what you might find, because of pain, that they're struggling to get to sleep, or they're waking frequently. So many of my fibromyalgia patients go, I fall asleep really easily because I'm knackered, but yet every time I turn over, I'm coming round because I'm in pain. Now, this isn't my area of expertise, but like, check in with their bedroom scenario. Have they got good quality mattress? You can get pillows that are more like side sleeper pillows that keeps your neck and shoulder in structural alignment. Is there anything else that needs to be done to support that structural alignment? Because that can help. And then thinking about basics like temperature regulation and light regulation within the bedroom. Really important. Those that struggle to get to sleep, or even if they think that they get to sleep easily but wake quite quickly, do think about sleep hygiene. Think about minimizing mobile phone exposure for the hour, ideally 2 before they go to bed. Thinking about what can be done to help, you know, temperature. Do they need to open a window? Is it road noise? They've got to close a window. Do they need blackout blinds, etc., etc. They're all the things that I want you to, you know, have in your discussions. And then if they need support around sleep or depth of sleep, I've put you some supplements I think would be most beneficial in there. Your magnesiums, your phosphorine, your herbs, valerian, lemon balm. If you're not a herbalist, you can use the pre-programmed, you know, supplements already in the right formulas. L-theanine, Epsom salts, if they can bath, remember that also helps with magnesium and calming the nervous system. Lavender oil. Now, let's really focus on getting nourishment right. Let's really focus on how do we achieve that rainbow of colour. And like I said, think about how to make this easier for your patients. Thinking about maybe ready meals, you know, food doctor, or what's the other one? A vegan one. Anyway, thinking about companies that sell in relatively safe containers, ready meals that provide phytonutrient density. Maybe they're gluten-free, they're dairy-free, but they're easy. Field doctor. Yeah, field doctor. And a plant one. Can't remember what it is. Anyway, it'll come to me. So how do we make this work for people? Then we've got to think about toxic burden. So I already said that toxicity is a driver of poor mitochondrial health. Now, if we have mitochondrial dysfunction, then we're never going to right that with no amount of B vitamins, carnitine, magnesium, if we don't get to the root. So think about the food that they're eating. Think about exposure to herbicides, pesticides, organophosphates. I was reading an article only this week about strawberries having the amount of forever chemicals that are in non-organic strawberries, chemicals that can take between 100 and 1,000 years to degrade, way over our lifetime. Thinking about things like chickpeas, thinking about oats being such high levels, coffee being so heavily sprayed. So what can we do to clean up the diet? If they can't afford to go all organic, dirty dozen, clean 15. Air. Okay, we all saw in COVID how clean our air became when the cars are off the road, the planes are up the sky. Is it about using a HEPA air filter in the house, or using things like Himalayan salt lamps, or anything that can clean the air? Plants clean the air. Water filter systems. Now, we're talking very practical. What else is toxic in the environment? Thinking about mold, thinking about electromagnetic fields, thinking about relationships. How many people, whether it's your parents, your loved one, your friends, that are surrounded by toxic relationships? And this all needs working on, because so often people won't heal when you leave them in a toxic environment, and that includes the whole picture. And then we've got to think about what ingredients do we need to put in to be able to support their mitochondria. Now, I will always say test. Do your NutriVal, or if it's not easy to draw blood, do your metabolomics, because then we're going to see what that need for raw materials are. Obviously, if people can't afford it, maybe putting in some blends that are aimed at, you know, put your B vitamins in, put your magnesium malate in, put your fish oil in, and then maybe put a blend in that's got some CoQ10 and carnitine in it with some lipoic acid, for example. But I will always say first test. Then we might have got a CRP and an ESR. It doesn't show raised markers, but remember, they're only part, they generally are good in acute phase inflammation, but not always good in chronic. So thinking about what ingredients can be helpful from an anti-inflammatory point of view. Your curcuminoids, ideally mixing it like active preparations like C3 complexes, or mixing it with black pepper, which again, many of the products on the market have the combination of the two to allow for better absorption, or liposomal variants of curcumin. Boswellia. Boswellia is one of my favorite herbs from an anti-inflammatory point of view. Again, if you're not a herbalist, I'm not asking you to mix it, thinking about preparations already available, maybe with 400 milligrams twice daily. We can go higher doses, but work within the remit of your specialism there. EPA and DHA. EPA is particularly anti-inflammatory, but again, we don't want toxic fish oil. So you want to go with a company that batch test all of their fish oils, that get it from small fish in order to reduce the toxicity in the market. White willow bark, remember that's where aspirin came from. Anybody's got an aspirin allergy, you mustn't use white willow bark, but you're thinking about what else can be used as a pain response at this point. White willow bark can be really helpful to support pain. And then resveratrol, which works on multi-level system. There's loads of great research about resveratrol as a anti-inflammatory in autoimmune diseases. Some really good research in IBD actually of resveratrol as an anti-inflammatory. So the more that we get this synergistic combination of inflammation and downregulation, the more that we might be able to help patients on a pain level. And then thinking about what can we do to support that HPA-TG axis, hypothalamus, pituitary, adrenal, thyroid, gonad. The more that we are balancing that axis, maybe working on the high cortisol through lifestyle medicine, through breathing, through connection, barefoot walking, meditation, mindfulness. This is where we're bringing in the mind-body connection. Because if we don't get that, if we're working with somebody that's maybe had high stress for years, or maybe they've had adverse childhood events, they are significantly at greater risk of chronic illness or chronic imbalance because their axis was already completely skewed. So maybe they'll say, I'm not working now. I used to work in the city, but because of my health, I've now been not able to work. But they've got this baseline level of high cortisol or high adrenaline. And remember, certain SNPs, ADRB1, ADRB2, encourage the conversion of cortisol to adrenaline. When we're in an adrenaline state, things will happen within our body. Basics like clotting factors will go up, blood pressure will go up, but our pain receptors will change initially acutely, so that if I'm a soldier on the front line and get my arm blown off, I can block out that pain. But remember, those things are life-saving and short balance. If we're constantly in that hyper stress arousal, we need to do something. And yes, we've got supplements like ashwagandha, rhodiola, but actually please think lifestyle medicine first. Now, that person might not be able to go out for long walks, but can they breathe? Yes. Can we focus on some simple breathing exercises? Yes. Can we walk into the garden? Can we barefoot walk into the garden? Possibly. So let's think about basics. And remember, lifestyle medicine is generally free. So for those of your clients that maybe don't have big budgets for testing and supplements, use what Mother Nature gave us as medicine. And then thinking about vitamin and mineral deficiencies. So zinc's really important for testosterone balance. Thinking about how important it is to look after estrogen to progesterone balance, support estrogen detoxification. And then essential fatty acids. Remember, without good levels of essential fatty acids, we're not going to get optimal hormonal imbalance. Now, if we go into thinking about ATP production, and in a minute, I'll share a screen of the Nutriral, which I used in the case study. We need to get those basics right. We need the proteins, the carbs, and the fats from macronutrients. I describe this to patients like putting petrol into the car engine. Now, you might be paying for the petrol, but if you haven't put the nozzle in the car correctly, you might be spilling it all over the forecourt. So you might be eating proteins, carbs, fats, but again, have you got the correct nutrients to transport those into energy production? B1, B2, B3, magnesium are heavily involved at the top of the energy transport chain. And then once we've got those, the petrol in, maybe we're losing some all over the forecourt, but we're probably going to be getting some in. I've never seen anybody's that aren't getting any nutrients in. Then we need the other cofactors to be able to create miles per gallon from that fuel. We need to make sure we've got optimal levels of iron. So are you testing serum iron as well as hemoglobin and ferritin? Because only then will we be able to get a true picture, or TIBC or UIBC. Are we using the NutriVal to get a serum CoQ10 and a serum glutathione level? All important ingredients in there. And then again, checking in on magnesium and B vitamin status. So these are essential inputs into mitochondrial function. Without mitochondria, remember there's mitochondria in all of our muscles. Without mitochondria, we are never going to fuel our muscles. What many patients say, not only does it hurt to the touch, but their muscles are screaming at them. They might walk up the stairs and feel that everything is screaming. That's mitochondrial imbalance. And if we don't look through the eyes of the full picture, you're never going to make a difference. No pain med, it could make it worse, but no pain med is going to make any of this better. I assure you of that. So the more that we get to the root, the better a scenario. And then we've got our conditionally essential inputs. Now remember, things like glutamine, conditionally essential. Your body, you don't take it in, then your body will make it. But many of these are still deficient because of the ultra processed fast food industry that we live in, with the high inflammatory grain burden. And I don't want to be generalizing, because that's wrong of me, but often when people are chronically fatigued, chronically pained, is spending hours chopping your vegetables where your muscles hurt. Is that going to happen? Maybe not. So what I'm saying to you is we need to make sure that we're looking at everything. Okay. Now, let's go on and think about oxidation. What drives oxidation? So very simply, we'll have more oxidation if we've got more inflammation. Stress drives inflammation. Inflammation drives oxidation. So now we've got to be thinking about stress, inflammation, and oxidation. We know that as we age, we're subjected to more oxidation. We know going to the gym and lifting weights can create wear and tear in our muscles that can create more oxidation. We know that the modern day diet, the way that food is cooked, thinking about not very good oils, pro-inflammatory grains, drives oxidation. We know that the way that food is farmed, thinking about those strawberries, we'll go back to the strawberries and the forever toxins in the strawberries, thinking about genetically modified, drives oxidation. Now, what is important? We know that mitochondrial imbalance, lack of optimal ATP, drives oxidation. So if you're not looking at this client through the lens of free radical damage and increased oxidation, you're never going to get them to the end result. Because if they haven't got oxidation, I'll eat my hat, because of all the processes that are happening that led to fibromyalgia. So we've got to take our clients on a journey to really understand this, and then be thinking about digging down deep into those things that went on before. Vaccination, I haven't got time to go into it, but we know that as a result of microRNA, which is what was in most of the vaccines, that there is increase of cancers, that there is increase in chronic autoimmunity, people with autoimmune diseases having flares, even though they've been stable for years. Like, I'm not anti-vax. I'm just saying, think about things like this when you're digging down deep, thinking about their story right back to childhood, their trauma. These are all things that are so important. And look, guys, if we don't go deep enough, our clients are never going to get beyond half fixed. And if our clients don't get beyond half fixed, A, they're not going to refer more people to you. B, they're going to lose faith in our industry, and C, they'll stay on this perpetual journey of pain and exhaustion and emotional deficit. And that's not living, that's existing. So that gives us just an insight into some of that depth of where we need to be pitching ourselves. How powerful does that make you as a practitioner feel? Because you've got the tools in your kit bag that sadly our medical doctors, our GPs, even the rheumatologists, they don't have, because they haven't got the time with the patient sat in their office. They haven't got the resources. They're not equipped with the testing that we've got. So to me, we are so powerful in this journey. Now, what I want to do is apply that knowledge to a case study. So I want to introduce you to John. John's a 58-year-old engineer who has always been an avid cyclist. He used to cycle between 100 and 150 miles per week, generally at weekends. After a motorbike accident where he injured his neck and broke his femur 8 years ago, he had his legs surgically pinned with titanium rods, which then were removed. He has been left with chronic pain, which has been diagnosed as fibromyalgia. John is now very inactive and would love to get back on his bike. His pain is 9 out of 10 on a good day, 10 out of 10, well, he actually said 12 out of 10 on a bad day. He was referred to me by a chiropractor who feels structurally his neck should now not be driving the chronic muscle pains through both of his arms. This is a chiro that sends a lot of patients my way, and she's an amazing chiropractor, but she often wants the depth that functional medicine can give her. As a child, John had been brought up by a very strict father who had physically hit him with a belt to keep him in line. He felt rejected by his mother. He had been part of the Catholic Church and he'd witnessed some sexual intentions. He said it didn't happen to him, but he had seen it. He developed asthma as a young boy, although no longer feels he has this. Quite often when you look at asthma, a lot of people say that asthma is associated with not being able to get our breath out, not being able to use our words, not being able to express our emotions. Was that why he was diagnosed with it as a young child? Couldn't stand up for himself, couldn't stand up to his father, couldn't stand up to the Catholic Church, just different thought processes. He'd had lots of antibiotics from 8 to 18 due to tonsillitis, and then he had his tonsils removed at 18. He also had an appendectomy at 21. He'd had an unknown virus at university during his final year. He used exercise as a bit of a relaxant as his downtime. Basically, it was escapism, but much better than many people's escapism. He was in his second marriage and lost closeness with his sons who didn't like his wife. The most recent MRI to his neck was unremarkable. He's seen the chiro, he's also seen massage therapists, acupuncturists, some benefit, but nothing that lasts more than a couple of days. So let's plot the timeline. Currently diagnosed with fibromyalgia, migraines, chronic pain, chronic fatigue, and depression. So family history of trauma, mum had smoked through the pregnancy. Now, mum had emotionally rejected him as a young child. He'd been bullied at school, didn't really feel that he'd got purpose. He was also born by cesarean section, and that back then it was a time where you got dumped in a nursery at the hospital. He was bottle fed. He didn't feel that there'd ever been emotional closeness with his mum. He'd had the recurrent tonsillitis, tonsillectomy at 18, appendectomy at 21, virus of unknown origin, lots of antibiotics. He then had a traumatic divorce, lots of family stress, children rejected his new wife. He had a motorbike accident, broke his femur and had a neck injury. He'd had 3 surgeries, including the last one to remove the titanium pin. So he had no external objects in his body, and he felt he was in a perpetual cycle of pain and depression, living in the past of happier days. So I always do a good review of the systems. Got lots of multiple antibiotics, non-steroidal anti-inflammatories, pain medications right up to morphine, codeine, which then drove constipation, lots of wind and bloating. Endocrine system, adverse childhood events, lots of stress, learned to self-medicate with exercise, which of course he can't no longer do. Rush of cortisol, which he struggles to control. He would have got on his bike historically. Asthma as a child, but doesn't even use an inhaler now. Respiratory, skin, bit of contact dermatitis when working more hands-on in engineering. He had worked with chemicals 10 years ago, but nothing in more recent years when he'd had the contact dermatitis. Musculoskeletal system is everything we've talked about. The pain, obviously the fractured bone, the bad neck, but all of that had kind of been treated, and what he's left with is his fibromyalgia, chronic pain. Nervous system, depression, pain receptors upregulated, headaches, sleep disturbances, detoxification, lots of pain meds, paracetamol, non-steroidals. He had worked with chemicals 10 years previously. He can't process alcohol or caffeine, which makes me think multiple SNPs. ADH1C on the alcohol, CYP1A2 maybe on the caffeine, cardiovascular, nothing to report. So his dietary review prior to accident was very protein driven due to cycling and using lots of like quick glucose gels. Since his accident, increase in processed quick fix foods, low in diversity, low in fibre, low in phytonutrients, low in liver supporting nutrients, high in refined carbs, moderate protein, more towards saturated fats, low in omega-3, and lack of hydrating fluids. He had very little self-care, lots of screen time with work and watching YouTube, basically watching people out on a bike, which is a bit like adding insult to injury. No energy medicine, so he wasn't doing anything to support himself, nothing for his mind, his body, his spirit, any of that. Sleep was poor but long, so he was sleeping sometimes 16 hours a night, but no restoration in there whatsoever. Some days doesn't leave the house, work from home because of COVID, does physio exercises most days. So let's look at his ATMs. Family history of autoimmunity with his mum, premature, so poor gut diversity, first 1,000 days of life, no real feeding of the commensal bacteria. Triggers, he'd had COVID infection, breast implants, sorry, that wasn't on him, I've not taken that off. He definitely didn't have breast implants. High stress, sorry, ignore that. I must have cut and pasted that from somewhere else. Again, no hormones in there, but those adverse childhood events and what went on in the Catholic Church, definitely a trigger for him. Now, what was the biggest aims of my first consultation? Addressing his digestive health due to its connection with inflammation and neurotransmitter production. Supporting his brain health, I'm thinking neuroinflammation, generally for healthy neurotransmitter production and pain modulation. This includes optimizing his blood sugar balance, sleep and circadian rhythms, exercise, dosage, so thinking about how can we get some gentle exercise in, managing oxidation, stress and inflammation. And then finally, supporting the nervous system to create more consistent stages of regulation. So that was loosely what I was trying to achieve. So what did I do? So I'm going to send him away to do a NutriEval and a GI-FX. Dietary-wise, let's focus on blood sugar balance, increase phytonutrients, increase omega-3 rich foods. 10 minutes of daily grounding and connection. I wanted him barefoot walking. He's got a massive garden and doing some breath work. So that's as simple as we could begin at this stage. And then after he did the NutriEval, I wanted him on magnesium, and I did a blend of turmeric, boswellia, ginger, anti-inflammatory nutrients, all in the one product. For completeness, I use Kappa S because it's just a good all-in-the-one biotics research. Okay, so this is his NutriEval, page 1 of his NutriEval, looking at the 5 pillars. High levels of oxidation, high levels of mitochondrial dysfunction, intermediate levels of omega balance, toxic exposure, methylation, all pretty high numbers. So looking at these antioxidants, great, his diet was low in them, but also his need for them was high. So remember, even in people who've got amazing diets, their antioxidants might come out as really high need. And it's, you know, I describe antioxidants a bit like trying to regulate your central heating. You might turn it to 24, but if you leave the back door open, you're never going to get those levels that you're after. B vitamins, remember they're water soluble, so they're always one of the first to come out in that high need section. They're not always going to come out, but they're one of the first to come out. Magnesium, look how stressed his poor body was. Look at the high level. So I'd given him magnesium just blindly, but good. Now, if we look at his energy transport chain, actually, he's not doing too bad up here. His pyruvic acid is raised, is magnesium deficient, but look down here. This is where he's got the biggest issues. Think they're particularly cofactors. Now, being the NutriVal, we get the extras. So over here, you get this in the metabolomics, which I love, oxidation marker. So he's got high levels of lipid peroxide. Does that shock me? No. But in the NutriVal, you're also going to get serum levels of glutathione, which is low. Serum CoQ10 was actually on the high end, but look here, his glutathione was almost falling off the bottom of the chart. His vitamin D was low. Remember, this test uses Ng per ml, not nanomoles per litre, which most of you are familiar with. So that's why the reference range is lower, because it's a different measuring tool. And his homocysteine, look at that homocysteine, 28.1. Neuroinflammation. This is his GI effects. So he's got, okay, nothing inflammation, but I wasn't thinking IBD, maldigestion, 6, metabolic imbalance, 8, dysbiosis, 9. So his commensal bacteria is definitely suboptimal. It's not quite deep in the red, but it's in that orange. His pancreatic elastase is low. This should be greater than 500 at his age, okay. But he's not 70 odd. We wouldn't expect it to be that low, but think brain, pancreas, connectivity, think about the messages, think about mindful eating, mindless eating. His products of protein breakdown are low. I'd like them in that 3rd quantile. Nothing going on inflammatory, but I didn't expect it. Short chain fatty acids and butyrate are low. Think poor diversity within the diet. And then let's have a look at some of his commensals. So he's got high levels of lactobacillus. He's got high levels of Deusoflavibrio. He's got higher, but not off the chart, levels of Methanobravinobacter, SIBO. That is your SIBO picture in there. Now, look, you need a breath test for confirmative, but I didn't go ahead with the breath test for him. To me, that was big enough. So he'd been dedicated to his wellness journey and had initiated all of his loss plan. He found the lifestyle medicine part the hardest, which they always do. So goals from these results: to reduce homocysteine, to support mitochondrial function by supplying them with the nutrients essential for optimal ATP, to reduce oxidative stress, to reduce inflammation. So they were my goals. I explained this. He was over the moon with his shocking results, because it meant that we could look for improvement. So plan number 2, to continue to increase antioxidants by focusing on a rainbow of colour, more focused on anti-inflammatory. And he was so bought in at this point. His wife also came to this appointment. Lifestyle, mouth taping for better functional breathing, breath work to further develop. Write a letter to your sons that you don't need to send. You've got so much emotion about that breakdown in relationship. Supplementation, a methyl B complex to lower that homocysteine and support energy. Increases magnesium malate. So I've given him 400, I went up to 600. Omega-3, 2 grams of EPA and DHA daily. Glutathione, we just start on 500 milligrams, and to implement a 4R protocol with berberine for the kill-off, mucin support, proanthocyanins to raise akkermansia to support diversity, to support the presence of bifido, and a mixed strain probiotic. So he came back to see me after 8 weeks. He'd done all of that. Pain medication had reduced. His pain, remember, was as high, well, 12 out of 10, he said, was down to 6 out of 10. So it wasn't non-existent, but it was down. His sleep was improved. He needed less of it and felt more restored, more energy, more time outside of the house, more glimmers of happiness, and less emotional pain. He'd done what I'd asked. He'd wrote to his sons. He didn't send them the letter, but he'd also reached out to them as a text message just to start the process of connection again. Okay, plan number 3, carry on with the methyl Bs, carry on with the magnesium, carry on with the omega-3, carry on with the glutathione. I now used a blend of antioxidants, which included vitamin A, C, E, zinc and selenium, and then liver support through NAC, bilberry, lipoic acid, and CoQ10. Vitamin D, because although his levels were 34, I wanted them up a bit more from that. Carried on with that anti-inflammatory blend that I'd been using at the beginning. And I also added in monolaurin for some antiviral support. Remember, he'd had this virus of unknown origin at university, 21. EBV, I hadn't tested it, but something like that. So came back to see me 10 weeks after doing that. His pain was at 5 out of 10. He'd been on his bike for 30 minutes, which had completely wiped him out for the rest of the day, but not the day after, interestingly. He was feeling more empowered. He was feeling more compassionate. And remember, these are big words, powerful words. Feeling more hopeful and feeling more grateful. And I really dig into the feelings that people bring into the consultation. And they were much bigger feelings in a beautiful, powerful way than we'd experienced today. Now, remember, our journeys with our clients are just that. They're a journey. They're not a destination. I'm still working with John now. He's still got a way to go. But look at the change in those words. He'd felt hopeless. He'd felt despair. He felt there was no point in living. He now is hopeful. He's grateful and he has joy. To me, that's worth every moment that we spend in the functional medicine paradigm. And we can make a difference to these unexplained illnesses by explaining them to our clients. So thank you so much for your time, everybody. And I'll hand you back to Amelia.
Thank you, Jo. That was such a great session, and we are over time, but if anyone does have any questions, they want to drop it in the Q&A box now, we will come to them. Although going through the presentation, I don't know what people could possibly ask because it was so detailed. It was brilliant. I mean, me personally, I was thinking with John having fibromyalgia and then getting back onto the bike, did he find that quite a difficult transition to get himself going, because obviously it's the
Definitely.
pain?
He actually had nearly got rid of his bike. So at the first consult, because it was from home, I could see the bike in the background. It was just leaning on a wall in home, and it was, you know, his pride and joy. I mean, you know, my bike would be in the shed at the bottom of the garden. There's no pride and joy to it, but his was in the bedroom where he was doing the consultation. I think it was a spare room, but nonetheless. He wanted to get rid of it because he said, I'm never, ever going to get back on it. So there was so much emotion on him getting back on it. And at first he was like, 30 minutes. What's 30 minutes? I'm used to ride. Like, he would ride 7 or 8 hours at the weekend. But he also had to change his mindset around it to not I can't to I can. And this is what I'm trying to get out of today's session, is not just the what should we test and what supplements should we do, but what should we talk about? Because the emotional side to this is just as significant in my head as the physical symptoms.
Yeah, absolutely. And then just a question maybe on the clinical practice side of things. How have you developed your connections over the years, you know, with these teams of referrals that you get, whether it's like, how
Great
have you
question. And what I would say is, first of all, anybody that you refer to is a reflection of you and your clinic. So let's say for me, so the person I was referring to from a functional osteopathy point of view is Dee Dee. Dee Dee is a functional osteopath. But in me sending clients to her, that's a reflection of me. So always be confident in who you are referring to, because if you send off a bad referral, then that would look bad on you. Or dentistry, I use Dr. Victoria Sampson, who is an amazing functional dentist. Again, she is a reflection of me. So it is important, and those of you that maybe are early in your journey, is go and find these people and do like a treatment swap with them, so they know you and you know them. That's quite good from a building your reputation and people referring to you, but it also allows you to understand how they work in order to make sure that, yeah, you're sending to good referrals.
Yeah, absolutely. And like you've just said, there is going to be a group of people on the call that are just starting out in their functional health journey. So with what we found throughout the sessions is that chronic fatigue, IBS, fibromyalgia, there's such a crossover. How do you go initially between determining this is fibromyalgia and then this is IBS? Because there is such a crossover.
It doesn't matter. In this circumstance, the diagnosis is actually irrelevant to me. It's the bunch of symptoms that matters. Because the truth is, we could say John has chronic fatigue, because he does. John also could be said to have IBS because he's got bowel symptoms. It doesn't matter what the diagnosis is, it matters to me what the antecedents, triggers, and mediators are. So I can't say the word don't care, because that makes me sound as though I'm heartless. The diagnosis is irrelevant to me. What's relevant to me is why, where, how, when, that timeline. That's what's relevant to me. The story. And that's why a good practitioner is a master of the story. The word fibromyalgia means nothing. The words chronic fatigue syndrome mean nothing. They're just umbrella term diagnoses that people get fixated upon. So in these circumstances, drop that diagnosis and become a master of the story.
Oh, lovely. That's a great ending to that question. No, that's perfect. And I think when you've gone in such depth with all the protocols and stuff, and having watched the series, people will see there's even a crossover with the protocols as well. Like you say, the lifestyle impacts, the lifestyle changes, the nutritional changes that people have to make as well. Just getting out in the sunshine and being at one with, you know, like you said, mentioned walking outside in the grass barefoot, it makes a difference. There's so many protocols and changes that have crossed over between the 3 webinar sessions. So yeah, it's absolutely like finding the root cause, isn't it? Absolutely.
Yeah, 100%.
Well, thank you so much for joining us, Jo, and thank you to everyone else that stuck with us for the last hour and a bit, and for waiting on us when we had those technical difficulties at the start.